Can you talk about the average premium for a family of four and some of the numbers that you discovered and believe we as a country could actually improve on the outcomes, healthcare outcomes, with the actual spend we have today, right?
Yeah, we're getting the numbers are pretty wild. I mean, I feel like we're really kind of getting to a breaking point with it.
Wow.
For what I work on, employer-sponsored healthcare, 186 million Americans are covered under an employer-sponsored healthcare plan.
Okay.
These plans can average increases anywhere from 7 to 10% annually. We see a lot of reports that come out that kind of measure these things. Kaiser Family Foundation does one, Milliman Index is another one. So there's a lot of studies that kind of measure this annually and changes for employers across the board. What we saw this year for 2025 was the average cost for a family of four under
Okay.
employer-sponsored healthcare plan is $35,119, which is just a astonishing number. Like
Yes.
that is unaffordable for an employer, that's unaffordable for an employee, and it's unaffordable for them to split that cost as well, right? Which is how these
That's
uh
it.
yeah, that's how they're structured in some way or another, right?
Yep.
And then another number to know that kind of governs this is the ACA affordability percentage, which is
Yes.
essentially where employers have to contribute, they have to contribute enough to keep the premium under this amount, which is 9.02% this year.
Got it.
So premium for one of your employees cannot exceed 9.02% of their take-home pay,
And
right?
this is updated on an annual basis, correct?
Correct. Yeah, it fluctuates a little bit, but it's always right at 8.5, 9.2. It's bounced up and down. But that's a pretty astonishing number too. And I see a lot of companies that
Yes.
are basically designing their contribution just to stay under that. And it's, obviously they'd love to do more, but with the way these costs increase annually, sooner or later they get to that point where they're kind of designing it just to be under 9% of the employee's income.